Memory problems are one of a number of symptoms that people with dementia may experience. Difficulty planning and thinking things through are also other symptoms.
Dementia affects millions of Americans, and health experts are also monitoring the neurological disorder in patients during the pandemic. So what do we need to know about dementia and Alzheimer's? Morning anchor and health reporter Kirsten O'Connor, she is off, but Bridget Ellison is standing by now to Ask a Doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
Dr. Tamika Haynes-Robinson is a neuropsychologist with Orlando Health. The pandemic has posed unique risks to people with Alzheimer's disease and dementia. We asked, how has the pandemic affected the way we care for patients with dementia?
So with regards to the pandemic and caring for somebody, especially someone who has dementia, is that there are some factors that we did not plan on. For example, the isolation. And the effects of isolation on not only the person with dementia, for example, but the people that have to care for them. You know, before they may have had a little bit of a social life where they were able to interact with other people, but now they're kind of constricted to being in each other's space for longer periods of time without a break, which we need as caregivers, of course.
And Dr. Haynes-Robinson also says the impact of isolation is something she stresses affects both physical and mental health. So we ask about some of the signs of dementia.
So some of the first things people think, oh my God, well, I always forget where I put my keys, for example, or my cell phone. That doesn't mean you have dementia. But if you find that you're consistently losing things and people have to help you find things that you use all the time, and it's happening over weeks and months, you may want to start being concerned. Other symptoms that you want to look out for is changes in their ability to focus, ability to prepare meals for themselves, remember what steps come next in familiar things that they're used to doing all the time. You want to look out for getting lost. People often say, well, you know, I could miss my turn on the highway, for example. But if you know where you're going and you find that, or the person knows where they're going, they're familiar with where they are, and they keep getting lost, or when they get lost is for a protracted period of time, you want to be very careful about that. Forgetting things that they know already how to do, that's a big sign that there is something other than normal aging happening here.
And Dr. Haynes-Robinson also stresses diagnosis is important.
Dementia is, think of it as an umbrella, and they're different, and each umbrella has different spokes, and there are different categories of dementia that are underneath those spokes. So Alzheimer's is actually a type of dementia. There's also vascular dementia, there's Lewy body dementia, there's several different other types of dementia. And those are all assisted through proper evaluation and diagnosis so that we can plan better treatment for you. The different dementias present differently. They affect people slightly differently. It's not just a memory disorder. It changes things like your ability to concentrate, work out problems, function in your daily life, drive. It affects how you process visual information. So it's important to get the right diagnosis so that your treatment plan is more comprehensive and effective.
And a few months ago, we spoke to a woman who shared her trials of caring for her mother during the pandemic. You can find that story at clickorlando.com.